Okay, let's dive into a really common health topic: urogenital infections.
Get this, up to 80% of women will have a urinary tract infection, or UTI, at some point. So to get how UTIs happen, we gotta look at the urinary system's anatomy first. So how exactly do these super common infections even get started?
Believe it or not, most UTIs are from E. coli, a bacteria normally found in our gut.
And several things can up your risk, from your habits to other health conditions.
Yeah, it's really a mix of things: your body, the germs, and just your environment.
Most UTIs are what we call ascending infections. Think of bacteria climbing a ladder upwards.
Okay, but how do you even know if you have one? The symptoms are key. Now, it's super important to know the difference between a bladder and a kidney infection.
Cystitis? That's the most common kind, just affecting the bladder with symptoms right there.
Pyelonephritis, on the other hand, is a kidney infection. It's much more serious, with fever and chills.
So how do doctors make sure it's a UTI?
Well, it starts with a simple test.
A dipstick test is the first step. It quickly checks for signs of infection. Then, for a closer look, they check your urine under a microscope for the actual bacteria.
And listen, if there are no white blood cells in there, it's probably not a UTI. All right, once it's confirmed, we're talking treatment, and even more important, prevention.
Usually, a course of antibiotics is the way to go, tailored to how bad the infection is.
But honestly, preventing one in the first place is your most powerful tool. These 5 tips are huge. Simple habits like these can make all the difference.
So, knowing the signs is step 1 to staying healthy. What should we break down next?